It is Monday morning, which means it's time for another installment of The Chew with Dr. Drew. Dr. Drew Markham is in studio. Good morning to you, sir.
Good morning.
I can't believe that 5 weeks have flown. We're into week 6.
Absolutely. It's gone by very quickly.
The final installment of The Chew with Dr. Drew. And I want to thank you for taking the time out of your very active schedule to inform us and to assuage a great deal of anxiety a lot of us have about sitting in the dentist chair. Let's talk about one more thing, because I experienced a great deal of pain in my lifetime from a lower lumbar issue, but sometimes these muscular issues can be associated with what's been going on up in the upper regions of our bodies.
Sure.
And I need an explanation on this, Dr. Drew. Neuromuscular dentistry. That sounds like a mouthful, pardon the pun.
Absolutely. In simplest terms, we can take this back to a Sesame Street level where
Please.
The head bone is connected to the neck bone, is connected to the backbone. And what we do know is that most pain actually comes from muscle. And so we have a lot of patients when we do our initial screening, and we look at their joints and we look at their neck and ask a lot of questions about their ears. If the muscles are not happy where your teeth happen to fit, that can lead to a lot of issues, whether it be headaches, including migraines. It can be neck issues. It can be clicking and popping in the joint, and all sorts of other symptoms that people wouldn't typically relate to something a dentist could help with. And we don't necessarily treat everyone that has these imbalances, but for those people that have daily chronic pain, that have been to many different practitioners, whether it be an acupuncture, chiropractor, and have had some success, but it hasn't been sustained, we're often able to help those people.
And what symptomatically would tip someone off that maybe this would be something that someone with your expertise could help?
Well, when we go through the checklist, again, I mentioned things like headaches, neck issues, ear problems, whether it be vertigo is something that we see fairly commonly. So we've got those symptoms that can be related. Then, of course, we have to look at the signs, which is what we see in the mouth, and try to relate whether those two are related and whether we can help. There are other reasons that you can have headaches and neck issues, but very often it can be related to how the teeth fit together at its base.
Now, I just want to say to our listeners as well that there's something very unique to your practice. As I was going through your biography a few weeks ago, you were credentialed in many specific areas of practice, and it's a testament to your commitment to being the best dental practitioner that you can be. And I asked you this before we went on the air about, physiologic aesthetics. People want to look good, number one, and
Sure.
This is one of the reasons that they come to see a dentist. But there's so many things that go before that you have to look after that we are not aware of as a layman.
Sure, and the truth is I got into this type of dentistry following a cosmetic course. I went to learn how to do veneers, about 12 or 14 years ago. And then I was exposed to a lot of other issues that are related to our physiology. My degree in undergraduate was in physiology, and it answered a lot of questions for me that weren't answered in dental school. So it started a long journey of training in how to help people that are having these chronic pain issues. It led into some orthodontic stuff, some sleep stuff. But again, I think the underlying issue is that everything is connected and things don't happen by accident. So when people are having, chronic headaches, people often say, well, they're normal headaches. And I'm like, well, what's a normal headache?
Right.
You get so used to it that they become normal. But certainly that's an indication that something is going on.
Now, if something as simple as someone having bad breath could be symptomatic of something more than just eating an onion.
Yes. That can often be related to bacteria on the tongue. There are other cultures where, including brushing your teeth, brushing your tongue is just a part of the daily
Right.
routine. And it hasn't really been in North America so much, but that's the first thing that we look at. There are some other things that can be related to diet and that sort of thing, but the most common is tongue bacteria.
Now, I know that you spend some time as an instructor, as an educator, but can you just briefly tell me a little bit about the Las Vegas Institute? This is actually quite a reputable institute.
Absolutely. It was the first, I went there at first to learn about cosmetics, and that was something that was very popular a decade or 15 years ago. But then it opened my eyes to a lot of other things. And it's a standalone facility that is just for training postgraduate dentists. And after having taken, 25 courses or so, I've also become an instructor over the last several years to help other dentists who are working their way through and supervise, because one of the really cool things that they do is live patient courses. So when you take a course, you take a patient out with you in order to do the training under the supervision of people who have done it many times before. And it's an amazing facility.
Well, congratulations on your success there. Before we end the final, the 6-week installment here, what do you think has been a really major advancement in the practice, of dentistry?
I think when you look at the problems that we see in most of our patients, they're the same kinds of problems that have always been around. But our ability to diagnose and treat those has changed greatly. And so, through technology and through training and those sorts of things, we're able to freeze people better. We're able to get them through their visits more efficiently. There's a number of different ways that we can help relax our patients. And so I think that is where the biggest change has occurred. And one of our goals in our office is to have someone, come through their first visit with us and say, oh, you know what, that was a lot easier than I expected it to be. And we're very proud when that happens.
Well, I mentioned this to you before we went on the air. We know that you have made a commitment to being the best dental practitioner that you can be, but you also are very specific about who joins the Dr. Drew Markham team. And I know you've added a couple of more folks to the Dr. Drew family, for want of a better word.
Yes. We've been very fortunate over the years to find people that have a very similar attitude and a similar passion for the things that we do. And people comment very often on just having a sense of that strong team and how everyone is caring in the office. And that makes it a great place to work. And, one of the things that we use as a guiding principle is that people don't care how much you know until they know how much you care. And as a younger dentist, I was trying to impress patients all the time with what I knew. But deep down, that wasn't really what mattered. And as I've hopefully matured somewhat, you start to see that, if you take care of people, then that will take care of everything else.
And we've talked about this in the past too. I've had some ugly experiences as a younger man, but over the last maybe 10 years, my experiences with a wonderful doctor in Sundridge helped me with my thinking to change how I felt about going to the dentist.
Sure.
He was kind, he was gentle, his staff were very compassionate, and I think it speaks volumes how, as we've talked about in the first episode of The Chew, how to assuage people's anxiety about sitting in that chair.
Yeah, people very often think that they're a lost cause, or that they're going to be the worst mouth that I've seen in the office. And the truth is that's just not the case. I've done some traveling dentistry in my history where I had people who were really in rough shape. But the truth is getting through the front door is often the hardest part. And I think sometimes people also expect to be shamed when they come in. But the truth is that, when you're coming to our office for help, that's what we're going to give you. How you got to this point isn't really relevant. We're going to help you where you're at now. We'll certainly educate and talk about how to help not have that happen in the future. But again, our job is to help people.
Well, I thank you so much for these last 6 weeks. It's been incredibly informative. You've been incredibly eloquent, and I certainly have come to understand how compassionate you are about making sure that those clients who come into the office, are treated in kind. And congratulations on your successes. And I can't thank you enough, because you've taught me a lot in the last 6 weeks. And, a person like myself thinks I know most of everything. And I thank you again, Dr. Drew. Just before we go, just let us know again how we can contact you and your office.
Sure. Office phone number is 705-788-3067. Website is drdrew.ca. We have lots of information. We have videos on past patients. We have forms available should someone be looking to be a new patient. A lot of great information on there. And again, thank you for the opportunity to share something that people don't always talk about.
Well, it's been a great rapport because I'm just asking questions that probably most everybody would ask. Again, we want to thank Dr. Drew Markham for being here, his practice right here in Huntsville. You've been listening to The Chew with Dr. Drew.